Wonderful.
So we'll post into the chat again for everyone where we post the recordings to this call as usual. So if you didn't know, and today is one of your first calls, we do share the recordings from all of the calls. And if there's substantive documentation like PowerPoint presentations that have information in them that are useful, we also post those onto our website. And we'll get that link into the chat for you here shortly and a few times through the meeting because we always miss a few people at the beginning. But welcome everyone. Conte, I hope you don't mind if I just get started. Is that good? Excellent. So if we haven't met before, my name is Katie. I'm the director of the Global Fund Advocates Network, and welcome to one of our regular open calls for our membership. Today is actually our third last call of the year, which seems a little crazy to sort of already feel that way, but we will be missing a middle of the month call because we will be attending the board meeting of the Global Fund, which we'll be talking about today, and we will have a debrief on it at the end of the month, the last week of November. Conte will share those dates at the end of the call, and you should also have them in your calendar, and you'll get 42 emails about it probably between now and then. And then we'll have a last call in December, which we usually use as an opportunity to look ahead to the next year, but also to look back at what we've done and how we've collaborated and how we're working together. So hoping that you'll be able to join us for those calls as well. But today we have, today being November 1st, a new month, which caught me a little bit by surprise, I'm not going to lie. We are looking at, we've reached out to a number of colleagues and would just say to anybody else on the call today, that if you do have World AIDS Day activities that you wanted to share with the group here, to please either use the chat or raise your hand. But we do have colleagues from the Global Fund Secretariat who are here to speak to us about their plans so that we have a bit of an understanding of where they're headed with their World AIDS Day messaging and plans so that we can also plan alongside them. And Stop AIDS, one of our members that we reached out to, is joining us today to be able to talk a bit about their plans. But again, we'll also open it up, and if there's anybody else who wants to share about their plans and opportunities for collaboration around World AIDS Day activities, we'll have time for that. We then wanted to preview the agenda and some of the priority issues for our colleagues in the communities and 2 NGO delegations that sit on the Global Fund board. So we wanted to look ahead at that agenda and just preview some of those priority issues with you. And there's a number of colleagues from all of the delegations who are attending today's call who will jump in with any key sort of information that I might miss in my overview. And then again, you can expect to find communication around the board meeting and what takes place towards the end of the board meeting and also at our debrief call at the end of the month. So that's our agenda for today. We may have a little bit of extra time at the end. I often believe that, and sometimes it doesn't happen. But if it does today, and there's something that you wanted to raise in terms of work that you're looking for, collaboration or support from colleagues throughout the network on, then we should have time to get to that. So fingers crossed. So today we're going to start off with our colleagues who are sharing around their World AIDS Day plans. And we're going to start off with Rosie Sims from the Global Fund Secretariat. So Rosie, welcome. I'm not sure if this is your first GFAN call ever or your first one speaking, but welcome. It's lovely to see you, and please go ahead.
Thank you. And yes, it's my first GFAN call, and I'm really happy to be here. So thank you very much for this time. So yeah, from the Secretariat's point of view, we're going to be aligning with UNAIDS theme of Let Communities Lead. We had a good call with the head of communications there, and he kind of walked us through the theme. So just to unpack it a little bit, the theme is Let Communities Lead. And this is kind of understanding communities in the sense of all people living with HIV, key populations, adolescent girls and young women, and other priority populations. So it's really going to be about not just the celebration of the achievements of communities, but also really a call to action to kind of enable and support communities in their leadership role. So it's going to be about highlighting the vital work that communities are doing, but also really trying to talk about the barriers that communities are facing in terms of these leadership roles. So barriers of neglect, like being under-resourced or under-equipped, but also barriers of active harm, so like criminalization of specific groups. So that's really something that we're going to be looking at in terms of trying to like make a call to action to remove these barriers and really unleash like the potential of community-led responses. So the Global Fund Secretariat is planning to explore this theme through different angles. One of the angles will be focusing on human rights. The other will be focusing on pediatric HIV, and also focusing on equitable access to innovations and tools. In terms of our communications plan, so we'll have a World AIDS Day webpage on our Global Fund website, which will be online 1 week before World AIDS Day, so on the 24th of November. This will be in English and French. We have a couple of op-eds planned at the moment. So we've got a first op-ed that's going to be a joint one between Peter Sands and Chip Lyons, who's the director of the Elizabeth Glaser Pediatric AIDS Foundation. And that will be on the challenges and opportunities in fighting pediatric HIV. We also have a second op-ed planned by Dr. Vuiseka Dubula, our new head of Community Rights and Gender Department. And I think this will be a really nice opportunity to have her voice really at the forefront on this day. We have a short piece by Peter Sands also that will be published in a booklet that's led by Health Equity Matters in Australia. And this will be distributed at a parliamentary breakfast event on the 30th of November. In terms of the content, so the stories that we're going to be pushing, our main piece will be a web story on Côte d'Ivoire about reaching men who have sex with men and transgender communities with HIV prevention and human rights interventions. So it's really going to be about highlighting the progress that Côte d'Ivoire has made in the fight against HIV, and then also looking at the programs supported by the Global Fund that really work on will focus on men who have sex with men and transgender communities and the fight against stigma and discrimination in these communities. So through information and education, legal consultations, reducing discrimination in healthcare settings, improving access to justice. So kind of really looking at this human rights angle and these specific populations in Côte d'Ivoire. We also have another 2 content gathering trips that we have planned. And these pieces will not necessarily be specifically on World AIDS Day, but will come during the month of December, so for like Human Rights Day. And so one of them is in Cambodia, and we're actually doing this next week. The aim of this project is to showcase Cambodia's successful efforts in providing HIV prevention services and human rights program interventions to female sex workers. There's a really low rate of HIV infections among female sex workers in Cambodia, and I think this story will really focus on why that is and the outreach work done by community workers and also former sex workers. So that will be really following one outreach worker in particular and looking at all the different aspects of the HIV programs in Cambodia. The other piece will be in Moldova, and this will be, the trip will be at the end of November to gather the content on this, and this will be about harm reduction programs in Moldovan prisons. So it will be all about the harm reduction services that originally were extended to some prisons in 2020, and then now they've extended it to include all the prisons in the country. So it will be about access to condoms, clean needles, syringes, drug treatment programs, and then also programs focusing on human rights for people living in prisons. So this is kind of like our main 3 content pieces that will be coming on the horizon. And we will have a social media toolkit that will contain all of our key messages and assets and resources for amplification. This will be in English and French, and it will also be shared 1 week before on the 24th of November so that everyone can use it and really amplify the messages from there. And that will also be available on our website, but we'll share it through an email as well. There are a couple of events that will be planned or where the Global Fund Secretariat staff will be participating. These are still in flux and still in kind of not yet confirmed. So yeah, there's more to be said about this, but one of them will be the Friends of the Fight Europe parliamentary briefing on pediatric HIV in Rome, early December, on the 6th of December. So that we'll have someone from the Secretariat go there, and there'll be other events as well, but we don't have the confirmed details at this point. So I'll stop there, and yeah, happy to take any questions.
Thanks, Rosie. That's a very helpful overview in terms of the sort of key focuses and the key sort of tools. Will help us, I know, plan sort of how to bring up some of our messaging that we've done in the past around harm reduction and human rights, as well as those specific populations, sex workers and people in prison. So thank you for that. I just open it up to, sorry, I don't have the right things open right now. So just open it up to see if there is anybody who has any questions or comments, either in the chat or by raising your hand for Rosie. Ooh. No, it looks like you're going to get away easy on your first call, Rosie, but come back another time. We might have more questions for you. But thank you for that. That's really helpful and just helps us know that there'll be, a dedicated webpage a week before where a lot of those resources will be. And just encourage anybody who has questions, always reach out. You can reach out through us if you don't have direct contacts into the team, and we can make sure that if there are questions that they get answered. So thank you, Rosie. Really appreciate it. And do stick around. You're welcome to stay for the whole call. So I'm going to pass it over to Jake from Stop AIDS now. So Jake, I know you guys have a lot of exciting events, possibly some GFAN speakers joining you in London. And so just over to you to share on what you're focusing on and what you'd hope colleagues might be able to amplify and or collaborate with you on for World AIDS Day.
Great, thank you, Katie, and lovely to see everyone, and great to meet Rosie there. Really exciting to hear some plans. Yeah, so my face has gone big on the screen. That's always nice. Hi, everyone. Yeah, really, I can't believe we're a month out from World AIDS Day. This is super, super exciting. So a bit about what we'll be doing as Stop AIDS in the UK. Stop AIDS will be hosting an in-person World AIDS Day conference on community and UK leadership in the global HIV response. It'll be a half-day conference in the run-up to World AIDS Day on the 28th of November. And we're really, really excited because we have some confirmed attendees, including Annie Hernasari and Dumi Gatcha, both from the Global Fund Speakers Bureau. And in fact, I can put some of their profiles in the chat just so you can have, I'll just share these links here so you can have a look. And as well as them, we'll also be joined by Solange Baptiste, who's the Executive Director of ITPC, the International Treatment Preparedness Coalition, joining us from South Africa. We'll have some UK community speakers, Mercy Shibemba of Wales and Robbie Lawler of Ireland. And we'll be also bringing together political representation from the UK with invites to various parliamentarians, but also the Shadow International Development Minister, and the International Development Minister will be delivering remarks via video. And so the format will be, there'll be a kind of welcome address, and then we'll be having the UNAIDS will be launching their report for World AIDS Day, Let Communities Lead, with a press conference, and that will consist first of all of a panel where the remarks from the International Development Minister will be played, and Winnie Byanyima will be speaking alongside community members to the report, which is really exciting. And then we're going to have some parallel panels and workshop sessions. We'll be touching on the impact of punitive laws on the HIV response, where we've invited Frank Mugisha from Convening for Equality Uganda to speak, obviously with the impact of the Anti-Homosexuality Act ongoing in Uganda at the moment. We'll also have a panel on ending AIDS and achieving good health and well-being in a resource-limited setting. So there we'll be joined by the Deputy Executive Director of UNITAID, Tenu Avathia, and the Foreign Commonwealth Development Office's Director of Global Health, David Winneray, will be joining to speak on that panel as well, again, alongside community members. And then another panel on sharing learnings on the HIV response, how we connect domestic and international responses and what opportunities there are for UK leadership and learning. And there'll also be a workshop. And the workshop will focus specifically on how we can be shifting power to place communities at the center of health responses. It'll be followed by closing keynotes from community leaders, and we hope the Shadow International Development Minister as well has been invited to speak. So really exciting lineup. Really thrilled that we'll have excellent community representation and excellent GFAN representation there. And we are in touch with the Global Fund about what specifically their representation on panels and across the conference will be, which is really, really exciting. The other exciting part is that if you are not based in the UK, you can join online. There are certain limitations around the venue and streaming and so on and so forth that we're just working out what specifically, given we're doing parallel sessions for the bulk, what specifically will allow for the best hybrid engagement. But I'm going to share with you all now our Eventbrite link. And all you have to do when you go to point on accessibility, please just note you'd like to join online. That's very crucial. But we'll be sending that out also via email. But if you are in the UK, we hope that you can join in person. But if you're overseas, please do join, and we'll be able to follow back up with information about how best to engage. I think that's most things or everything, but what questions do you have? Let me know. Thank you.
That's great. Thank you, Jake. That sounds like a very packed half-day agenda, frankly. So good luck with that as you pull that off. I think it would be helpful, just some reflection from you in terms of how we can support and amplify some of that work, especially like the report launch. I assume UNAIDS will have like a toolkit, and they'll have, all those kinds of things. But if there's anything in particular that you'd like colleagues to be doing either before or during the event or after, then please let us know. Are there any other questions or comments? I'm not seeing anything in the chat. And I'm going to remove that spotlight so it's no longer just a big head, Jake. That's me who does that to people, sorry. Any questions or comments? Okay. Thank you for sharing. Did you want to respond to whether there's other ways, or you'll share over the listserv as you figure those details out?
Yeah, sure. We'll definitely be sharing things over the listserv, but we'll be developing a bit of a toolkit ourselves around the conference. And yeah, we'll share that around. It'll be some social media assets that people can share. UNAIDS will obviously be developing their own toolkit, and so we're just going to see how those can kind of like align. But follow us on social media. We'll share details around. We'd love for you to amplify. But right now, the best thing you can do is register to attend, whether online or in person. And we'd love to see you. And I'll put my email in the chat so anyone can reach out directly if you have any other questions. I can see a hand up from Peter, though. Peter.
Yeah, hi, Jake. Thanks so much for the input. You said something about a shadow minister or something like that. I did not really understand that. So we talk about shadow reports here in Germany, which is something probably completely different. What you think about? So what is a shadow minister, please?
That's a really good question, and my apologies for not clarifying. It's a UK specific term, so I should have clarified. So it simply means the opposition party. So that is the Labour Party's. We have a shadow cabinet who essentially shadow, meaning oppose in the House of Parliament, the government ministers in each position. So they are essentially, if Labour were in power, they would be the international development minister. So we have thank you, Vincent, in the chat. We have representation from FCDO, from the Director of Global Health. We also have a pre-recorded video message from the International Development Minister, Andrew Mitchell, who sadly cannot be there in person. And so we just want to make sure that all parties in the UK are being engaged. So we've sent invites out to representation from all parties to have that opportunity to be at the conference. So yeah, I hope that answers your question. And the Wikipedia link will probably be more helpful explaining it than me. Okay, if that's everything, back to you, Katie. Thank you.
Thank you. Yeah, that's a great reminder about terminology. We call them critics in Canada, but rarely do the critics make it into government in those positions because they've said too much when they've been critics. So they usually don't make it in as the ministers afterwards. They usually switch that around. But thank you. Are there any other questions or anybody who wanted to jump in about any activities that they're doing around World AIDS Day that they wanted to share? Otherwise, I just encourage you, as you're developing your plans and as you see, notes from colleagues, to engage as much as you can with other people's activities, share over the listserv, tag Global Fund Advocates on Twitter to make sure that we're amplifying the work that you're doing. And you can expect to see some work from us as well around World AIDS Day that's trying to, amplify these key messages and relate it back to the Global Fund in particular. So thank you, Jake, and thanks again to Rosie and the Secretariat for their sort of overview. So as suspected, we are moving through this slightly ahead of schedule. So if you do have something that you wanted to raise with colleagues, we should have time for that today at the end of the call. I say that before we get into the meat of our conversation today. So hopefully I'm correct, but we're going to go to the Global Fund board meeting, and I'm just wondering, Conte, if you can pop up the slides again. And in particular, slide number 3, where just trying to give you all just a bit of an overview of the key agenda items that are expected at this board meeting. It's always a little complicated before the board meetings to talk about specifics, because all of the documentation and the conversations are considered private and for the use of delegations and board members and alternates until after the meeting. But broadly speaking, so that's why sometimes we can't get into specifics beforehand, but do like to give a slight overview. As is usual, it's a very packed agenda. It is 2.5 days of formal meetings, another half day of pre-meetings, I guess you could call it. And 1 to 1.5 days of constituency meetings where colleagues from different delegations do discuss some of the issues or some of the concerns they may have about the agenda items. And then there's also followed, and something I know nothing about because I'm not board leadership on any delegation, but there's a mini retreat for board members and alternates only the day after. So it's quite a packed week between the mini retreat, the pre-days, the constituency meetings, and the actual board meeting itself. But it's expected to sort of discuss and review, as it usually does, sort of operating issues, thematic areas, and governance and oversight issues. So it's just on this slide, just mentioned a few of the key ones, or at least I think they're the key ones. I'm probably missing a few. It does seem like at every board meeting, there's about 100 different things that are absolute priorities. But so there's a number of sort of key things. The operating budget, for example, will be discussed and voted on. So that's the budget for the Secretariat for the upcoming year. There's also there's been sort of, some movement over the last few years around evaluation matters and sort of switching the way the Global Fund evaluates its own work. And this has been the first year where some of those new pieces have been sort of put in place. So those are the kinds of things that, sort of get discussed on the operational level. And then there's a number of thematic areas, as I listed there, that are going to be reflected on, including an update on sort of the hoped for or intended, but not quite realized collaboration between the Global Fund and the Pandemic Fund, which was a huge topic of conversation at the spring board meeting in Vietnam, and ended without sort of a decision point, but maybe a bit more understanding of where some of the challenges between the two, organizations or institutions in terms of being able to collaborate were. So that's sort of what's on the agenda for those core board meeting days. And if we could just move to the next slide. As I said earlier, there's a number of delegation reps who are here from the communities and the 2 NGO delegations. So I won't go into these in a lot of detail, but we did connect with them to sort of make sure that in our heads, we were understanding what some of the key issues from their perspective that they might be looking for at the board meeting were coming up. So just a few thoughts from me on some of these, and then, open it to any colleagues from delegations who might want to add some more content or more sort of understanding of some of these priorities, and then we'll just open it up to questions. So sort of in this list, one of the ones that's always very interesting when it comes is the technical review panel update. So the technical review panel, the TRP, is that body that examines the funding requests that come into the Global Fund from proposed principal recipients and their subrecipients. And the technical review panel is independent from the Global Fund Secretariat and has a number of experts from different areas who sit on it and assess those funding requests. And so the report, when they provide it, is like, it gives us a sense both of the focus of funding requests, but also the quality of them, and then also the cross-cutting issues that the panel, the TRP, is seeing through, across funding requests. And this can give us really interesting detail about where and how applicants are focusing on things like using new tools or how they're incorporating RSSH, like resilient sustainable systems for health, and also things like how community rights and gender issues are being assessed and addressed in funding applications or not. But it gives a really good sense. It's quite an interesting report, and they usually, I believe, are made public at some point after the board meetings. And so that would be one to look for. After the board meeting. It's not specific. The information is very, it's generalized. So it's not, specific to any country in particular. So that's not the place to go for that information, but it does give a sense of sort of those overall themes and overall, priorities as they're seeing it come up. And then for this meeting as well, at each fall meeting, we get an annual report from the Community Rights and Gender Department in the Global Fund. So I'm not sure how this one is going to work, whether we'll have the new incoming director or the outgoing one, or perhaps both of them providing that update, but it should be, as always, a really interesting report in terms of how the work of the CRG department across the Secretariat and all of its functions is progressing. There have been a number of other sort of informal board meetings that are held virtually in the lead up to every board meeting. And some of those have been on health and climate and malaria risk. So those are also on the agenda. Quality assurance, which you will never hear me speak about very much because I am by no means an expert, but this is about the policies to ensure quality of pharmaceutical products, of medical devices, what the Global Fund did a lot of during C19 for personal protective equipment. And so the policies haven't been looked at in a number of years. And so there's sort of an update to them, hopefully a modernization of them that is being presented for the board's consideration at this meeting. What else? Sorry, I'm just looking at my list here. What else is useful? Well, there is always a resource mobilization update. These updates usually give us sort of the percentage of pledges that have been received, the number of contribution agreements signed and in place, and usually an updated set of points around lessons learned from the last replenishment and looking ahead to the coming one. This report is likely not dissimilar to past ones other than some of the numbers. And my sense is they don't always give us a very specific sense of where the Secretariat is focusing or where it has specific concerns, but it's a useful touch point for the governance body to understand where resource mobilization is headed or what some of the concerns are. And then I think, to me anyways, maybe one of the most interesting things at this board meeting is the approach that they're taking to look at strategic issues within the framework of Grant Cycle 7. So an entire day is going to be spent essentially looking at thematic issues and how they relate to the strategy, from the strategy, and how they're looking for Grant Cycle 7. So both looking at what funding requests are kind of going to, but also what some of the outstanding challenges are that aren't going to be addressed in Grant Cycle 7, so that there's an understanding of what's feasible and possible given both the level of funding and what funding requests have come in, right? So I think it'll be interesting. Maybe it'll be a test of the new board leadership and their style in terms of the board meeting. But it's an interesting way that they've framed an entire day of discussion. So that should be, well, I think it will be interesting. Let's see. There's a very, very, very long PowerPoint that has been distributed to delegations about those sessions, and it'll be interesting to see how we stay on topic and get something accomplished through those themes. So that's my really kind of big picture, general overview. And again, it's not possible for us to share any of this documentation ahead of the board meeting because it's under it's for internal discussion at the board, but most of these documents, if not all of them, do become available after the board meeting on the Global Fund website, and we'll be sharing links and information on how to access that in our debrief call. So that's my quick overview. We do have a number of colleagues from different delegations, and I just wanted to see if any of the colleagues from the delegations first wanted to jump in with any additional kind of content or context on any of these issues, or whether there's concern and the possibility perhaps of looking for mobilizing advocacy voices on some of these issues. So I'm not going to pick on anybody in particular unless nobody puts their hand up, but we do have a number of colleagues, and I just wondered if any of them wanted to jump in. I'll start naming people. Javier, perfect.
Everyone, can you hear me?
Yes, we can. Thank you, Javier.
Thank you, everyone. And I think, Katie, if I see the list, it's probably all priorities for the community delegations. The community delegations, as we speak, they are reviewing the documents, and they will come back to us this week on looking into the priority issues. I can quickly mention that, as you just said at the end of the presentation, the Grant Cycle 7 is something we're really looking into, especially on RSSH, PPPR, and C19RM, but also always with the lens of communities and how, for example, the wave 2 of C19RM investment, or how the 1/3 of the Global Fund portfolio around RSSH are really looking into community health workers and other communities who should be part of the resilient system for health. As you mentioned also twice in the columns, which I'm seeing one of the obsession of the committee delegation is country coordinated mechanisms, CCMs. And we also, of course, have been quite vocal together with the other two civil society delegations in the board around some trends in countries, like I mentioned, Kyrgyzstan, India, and others, where civil society and communities are in some way pushing some way out of the CCM. And there is, probably you've seen our statements and participation in previous meetings, that there is what we are looking not only to have some continuation of the CCM working group. We have two calls for the so-called Strategic Committee and ECG working group, which was basically to assess the challenge of the CCMs, but not necessarily looking into solutions. So we now want to ask to the full board and to the leadership how we will move forward this, because we see very concerning trends, the three civil society delegations, and we have been in contact with people in the Secretariat to address each case by case. And of course, this is also linked to community rights and gender. And as you mentioned, Katie, probably there will be a joint presentation of the community rights and gender coming from Kate and Boo, and I think we're really looking into that. We are a bit concerned around resource mobilization. We will be engaging early on, and there is a lot of work to be done with GFAN and other stakeholders. We have some concerns, and I think this is an interesting concern from many board delegations around the finance global health institution or the Wilton Park report, etc. And I think that will also be discussed probably in the preparatory meetings or during the board. As you saw in the strategic committee agenda, health and climate, I always want to say health and climate instead of climate and health, becoming a very interesting discussion. Of course, we are not only talking about the footprint for procurement and supply management, but we're also very concerned around access and vulnerability of key populations, HIV key populations, and communities living and affected by the diseases during a climate episode. Of course, criminalization is something on top of our, and it doesn't matter if it's not clearly outlined in the agenda, probably on CRG and CCMs, but we will continue like a broken record talking about CCMs. The next one, and I will stop in a couple of bullets, it's malaria, and has been also a very interesting discussion in the strategic committee, and of course it's a priority for our constituency, and we're coming back on seeing how the discussion around the board and the proposal coming from the strategic committee will be discussed to really be up to having the ability to respond to the malaria crisis. And finally, but not less important, our community delegation are walking into this board meeting with, as you know, a new communication focal point who has been working for a few months already, but will be the first board meeting as a communication focal point, someone you all know quite well, Maureen Murenga. And especially also want to acknowledge our new alternate board member, Jean-Paul Enama, who is also in this call. And I'll ask Jean-Paul, I'm not sure, Katie, if you want the long list of community delegation inputs or you want to react to the list, but as you see, they're quite aligned. But let me ask very quickly, Jean-Paul, have something to add on what I said, if this works. Jean-Paul?
Yes, thank you, Xavier. I cannot put my camera. I'm not in the ability to do that. I'm Jean-Paul. Thank you very much, Xavier, for presenting the work we are still on. Like you said, we are not coming to. We have our meeting next week, but the priority you have pointed out are those we will work on. But apart that, I think that you have raised the issue about CRP, yes, CCM, health and climate, and also human rights, which is also something. But it's coming to the report of community rights and gender is something we will also look on. So thank you, and thank you for it's my first meeting, official meeting, since I'm alternate board member. So I'm trying to get things I'm trying to get topics and how to interact with all of you. Thank you very much for welcoming me in this panel. Thank you.
Thank you, Jean-Paul, and thank you, Javier. That's really helpful. And at this point, I would normally point everyone to a resource that we have, which just sort of explains a little bit of a guide to the Global Fund board meetings and delegations. But when I looked at it yesterday, it is woefully out of date. So we are going to be updating that and making sure that we have, all of the leadership from the three delegations properly named, which we do not currently have, and make sure that that's updated as a companion piece, sort of going forward with our report and stuff like that. But welcome, Jean-Paul, and welcome. I don't know if Maureen's on the call today, but it's lovely to see her taking on this role and continuing to provide that expertise within the communities delegation. And I see other colleagues from some of the other delegations, and I just wondered if anybody else wanted to jump in on any key issues. Eli, I have you from Manahra, so welcome, and please go ahead if you have any questions or wanted to add further information.
Hello, good afternoon. I'm not sure if I can now, but you can tell me. I would like to share with you some concerns, as I will be at the Global Fund General Assembly representing the MENA H Coalition. It's a coalition of regional networks working on HIV in the MENA region. And nowadays we're facing lots of problems, not only the security issues that is happening right now in South Lebanon and in Israel and Palestine, but also due to this, for example, we were preparing to organize a kind of huge advocacy campaign at the League of Arab States on the occasion of the World AIDS Day. Now it will be postponed because of that. But the issue is that, and I think most of you know about it, is that UNAIDS closed the regional office for MENA. And this will put us under a very huge, risk because of the lack of resources, while MENA is one of the highest highest prevalence of new infections. On the other hand, we are at the lowest coverage in services and I think only 24% of the people living with HIV receive their ARV in the region. So that's why we're trying as a civil society organizations to loud the voice and to advocate for a new cycle of the Global Fund 1. And second, the support is needed because HIV is not on the government's agenda, and thus we cannot easily mobilize domestic resources. So I would appreciate any support, any advice from your side or any of the participants. I'm in contact with a few delegations until now, starting by the EMRO constituency and looking to other meetings while I'm there. Thank you.
Thank you. And yeah, thank you for raising those concerns here. I think it's great that you're going to be at the Global Fund board meeting on the sidelines. And I don't want to speak for any of the delegations who, have very intense and hectic schedules that are sort of represented here, but I am confident that it would be useful to make sure that you're speaking with the communities and 2 NGO delegations while you're there, and with us as well, and friends organizations too. So let's make sure that happens. But from a question for you is, have you been invited to the board meeting in the past? And if not, what is the rationale for attending this one, in the sense of, do you have a sense of anything that the Global Fund is trying to pursue in the area in the past, when there have been sort of regions or sub-regions where there's particular issues and where prevalence is quite high and resources are quite low or are not being used optimally? There have been things like research by the Secretariat through either the OIG or another body into what's going on there and making recommendations. There's also been, of course, with the situation in the Ukraine, there's been a lot of sort of on the ground work with colleagues in civil society there, between the Secretariat and civil society. So I'm just curious, is that sort of the hope of being in Geneva, to sort of talk about what options there might be to support the work in the region, given the sort of complicated context? Or is there anything else that you can share, Eli, about what else is needed, I guess, more specifically? I hope my question makes sense.
Yeah, for me, it will be my first time attending the board meeting. The issue is that the MENA Edge Coalition, as I mentioned, it's a regional coalition, or a coalition for regional networks and NGOs. And we are the applicant for the current civil society grant for MENA region. And this is the second cycle. We've heard that nothing is ensured for the third cycle because of the withdrawal of UNAIDS from the region. They divided the region into 3. So North Africa went with Eastern Africa, and Sudan and Egypt to West Africa, and the Levant is under Asia now. So if the decision is that we will not have this region that is called MENA from now on, we need to know where is our place and how we can continue our fight against AIDS. We need to know what is the slogan of no one left behind, and what's the plan to end AIDS in 2030 in a region where the prevalence is high. So these are the questions. I'm trying, as I mentioned, to take appointment with many delegations, including the civil society and the CRG, and we will see. Of course, any support from your side with your national delegations is appreciated.
That's really helpful clarification. Was there somebody else who was just trying to jump in? I'm not sure, but thank you for that. And let's connect after this call so that we can make sure that we have an opportunity to meet at the beginning of your time in Geneva and follow up from there. Okay, Eli? Was there somebody else who was trying to jump in? I'm not sure. I thought I heard a voice, but maybe it was just something in the background here. Okay. Sophie, I think we were going to just ask you to speak up really quickly on behalf of the developing country NGO delegations. You can react to that, or some of the other priority issues. So, Sophie, over to you from developing.
Thanks, Katie. I'm from the Developing Country NGO delegation, and I'm the CFP. I'm based in Zimbabwe, and I'll speak because I think I'm the only one from the delegation here today. So our delegation is also currently reviewing all the papers, and we have 3 key or core priority areas as a delegation, which are, promoting and upholding human rights, addressing the shrinking civil society space that we're all experiencing, and focusing on sustainability and transition. And many of these issues will be coming up at this board meeting. And Ellie, it's great that you'll be there because you will be bringing that, that national experience, and it'll be very interesting for you to see how things happen at a governance level. And I know that we are having a trilateral with you, with the 2 civil society delegations and the communities. So that's great. We're looking forward to meeting with you. I thought Javier's points was spot on, and we have similar areas of concern. I think around if we look at the co-financing policies that are going to be discussed, it'll be very important for us as those policies move forward within the Global Fund to ensure that civil society and communities remain as engaged as they are now, because there's a real risk of, as more funding flows directly to governments, that then, the thing that we love about the Global Fund of providing and protecting civic space becomes less and less. So that's a key concern for us. As Javier said, the CCMs and the eligibility, that's an ongoing concern. They'll be discussing the CCM evolution project that's been going on, and where do we go from here? If you look at the TRP reports, I think it was 90% of the grants went through to grant making. So the funding requests are of good enough quality coming from CCMs, yet we are seeing still real challenges around civil society and community engagement. Around malaria, there's a huge concern around malaria, and some of the documentation shows that we are off track of reaching global targets by at least 48%. So how do we get back on track? There's huge issues around vector control, resistance to medications, and low use of nets, and so it's finding that balance of prioritizing the priorities and ensuring the right disease split. But we're in real trouble. There's a real risk around malaria, and I think everybody's aware of how dangerous things are, especially with the climate crisis, and where there are huge floods, malaria cases go up and deaths go up too. Around the quality assurance policy, this has been quite hard to understand, but there are 2 various policies that kind of have been evolving at a different rate to the Global Fund's policy, which was last reviewed in 2017. So this is very much just about aligning it so that when there is a public health emergency of international concern, the Global Fund can then move faster to get medications out to people. And it also opens up space for more regionally produced medications as opposed to just internationally produced medications. I think I'll stop there. Katie, I think, yeah.
Okay. Yeah, thanks, Sophie. I think it's really helpful just to get a couple of the delegation's perspectives. We have some new leadership incoming in my delegation that I sit on, and I'm not going to call on them today. But I think this is just helpful and hopefully gives everyone a sense of sort of where the discussions are likely to be of most interest, I guess, in terms of what comes out of the board meeting. Just opening it up to see if anybody has any questions about anything related to the board meeting. Please use the chat or raise your hand. And what I probably should have started off saying, and I apologize, is that GFAN is invited as GFAN to the board meetings to observe the board meetings. But in addition to that, I sit as a member of the developed country and geo delegation. So apologies for missing that slight context for you all at the outset of this conversation, but just as an FYI. Any questions or comments? I'm not seeing any hands raised. It's a lot of terminology, acronyms, and those kinds of things. So hopefully we can do a good job following the board meeting in providing information about what has taken place and what's critical to understand coming out of the board meeting for our advocacy and work as communities and civil society organizations. So I did just want to go back. That is sort of sorry, is there another? I did just want to go back to, we do have a few minutes left on the call, and we did have one colleague from, I believe, Uganda, who wanted to share about their World AIDS Day activities. So Wabusimba Amiri, I'm not sure if I should have reversed that, but please feel free to unmute and give us a sense of your activities and how this network can support and amplify that work. Go ahead.
Thank you, everyone. I don't know if you can hear me well.
We can hear you and see you now, so welcome.
Oh, thank you. Yeah, it is Amir Wabusimba, Uganda Muslim Medical Bureau, an organization established by the Uganda Muslim Supreme Council. It is a religious institution here in Uganda. And as a medical bureau with about 72 facilities around the country, when I got a platform like this, I saw we as an organization also planned, and we are like, you know what? Can't we also tap into this to send a message on how we can stop AIDS by 2030? So through our religious leaders, and those are the imams and the structure of the Uganda Muslim Supreme Council, we've decided to advocate for advocacy and service delivery through the 8 districts of the Muslims around the country, and use our facility to deliver all these deliverables. In case of service attendant, at least we've got a platform that we can, as per now, we've got accredited facilities that are around 36 that are providing HIV care and treatment, and as chronic diseases around the country. As an organization, I think that is what you are also looking at, on how best maybe we can save humanity around the country. I thank you. In case of anything, then maybe I can also highlight if there is a question for me, please.
I think that's really great to hear about the work with the imams and using the facilities that you already have in terms of addressing the issues. And I would just really welcome if you wanted to share more information over the listserv about the specific work. Please always feel welcome to do so, and always highlight where it's useful for us to be sharing information or grabbing key messages that you're utilizing or that colleagues are using in the work that you're doing, so that we can all better understand it. So thank you very much for letting us know. And again, thank you. I see Javier has to drop off, and I'm sure some of you will as well, as we're close to the hour and everybody probably has another Zoom call coming up in 5 minutes. So thank you to all of our speakers. Are there any other final questions or comments around World AIDS Day or the Global Fund board meeting that colleagues wanted to raise here today? A very quiet crew today, so maybe we'll be finding ways to force some of you to ask questions. And there is a hand raised. I'm really sorry, Paul, I missed that. So Paul Sommerfeld, please come on in.
Yeah, thank you. Sorry, I've been deliberating whether or not it was appropriate to make this comment on this call, but as you keep asking for interventions, I thought at the end I will. Basically, as far we have a general concern in the Eastern European and Central Asia region, or which is the or Europe region for WHO. That Global Fund about 2 years ago decided no longer to fund activity by civil society at a regional level. And that they have continued funding HIV activity at a regional level, but not TB. And I was really just wanting to say, if you see any opportunity during the board meeting discussions where it might be relevant to raise that issue, we would be grateful.
Thank you, Paul. I think that's a really helpful pointer that delegations are always looking for. So thank you for that intervention. Appreciate it. I will pass it. So thank you, everyone. I'm going to pass it back to Quentin, who has a few final reminders and a few upcoming sort of events that we just wanted to make sure to highlight for you today. So Quentin, over to you to wrap us up.
Hi, everyone. Thank you all again for joining us today. So a few things to cover before we let you all go and get on with your lives. So the first one is our next call will be in 2 weeks. In 4 weeks, because in 2 weeks we're canceling the call because it happens at the same time as the Global Fund board meeting. As Katie mentioned, her and I will be there in person. So our next call is on November the 29th. And it will be a debriefing of the board meeting. So it will be very much a follow-up to this call. Then after that, we'll have a call on December 13th. That will be our last call of the year. And as Katie mentioned, we'll be looking back, looking ahead, talking about the present. It will be really a good time for reflection and planning. I also wanted to flag that we are co-organizing with Stop AIDS and AVAC a briefing on the pandemic accord negotiation. The briefing is designed for civil society and will take place on November 21st. We haven't yet started publicizing the event because we're still finalizing the design of our flyer. But for anyone that could be interested, we've noticed that we've been talking a lot about pandemic preparedness in various forums, but we don't see as much civil society engagement around the pandemic accord as I think we were expected. So if you haven't heard of it, don't know much about it, want to catch up with what has been happening and what will be happening in the next year, join us. It will be an hour and a half. And we'll make sure to make the conversation as accessible to everyone as possible. The idea is really to try to get a bit more interest and engagement on the issue. We also want to flag, and it's not on the slide, that the very last call of a TBHLM hub will take place tomorrow. As some of you might know, GFAN was hosting the hub since the beginning of the year. The HLM has now taken place, and so it will be the final call for the hub. We'll talk about the TBHLM itself, what has been achieved, what remains to be done to make the middling commitments of the TBHLM into reality on the ground. So it's not too late to register. Thanks, Kelly, for posting the link in the chat. And we hope to see many of you tomorrow on that call. I think that is it for reminder and announcements.
Great. Thanks, Quentin. Thanks, everyone. Have a great rest of your day. Don't hesitate to reach out if you have any questions from today's call going forward. And also, as always, you can find recordings from our calls on our website. So please don't hesitate to go there or direct colleagues there. Take good care, everyone. See you on the next call, not before.
Bye-bye.
Bye.